So, Manasvi, we are live now. We can start the session now.
Sure, thank you. Hello, namaste, and welcome to ForOptom Optometry Updates Expert Live panel discussion. Often students are in dilemma regarding the future prospects and career opportunities after completing their optometry degree. So today we have with us esteemed optometrists from different countries to discuss with us about exactly that, career options, what after optometry. This session is live on YouTube, and if you haven't subscribed to our channel yet, you can go ahead and hit the red subscribe button right now. My name is Manashwi Karki, and I will be moderating the discussion today. So let's begin by welcoming our panelists. First up, we have Dr. Shyam Singh from Canada. A brief introduction about Dr. Shyam Singh. He is graduated from Elite School of Optometry, Chennai in 1990 and spent 3 years in LVPEI Hyderabad learning anterior segment diseases and management, and later took his evaluation licensing exams at University of Waterloo School of Optometry to practice in Canada. He is currently a Doctor of Optometry practicing in Toronto, Ontario, Canada for over 16 years in his own private practice. He also has various articles in journals to his name, and he teaches and mentors university students who want to choose optometry in their professional career. Dr. Shyam, welcome to the panel.
Thank you.
Next up, similarly, we have Dr. Keshav Bhat from USA. Dr. Keshav Bhat graduated from Elite School of Optometry, Chennai as well, and completed Masters of Science program at University of Auckland, New Zealand, and Doctor of Optometry at the New England College of Optometry, Boston. He has been practicing since 2007. Dr. Keshav, welcome to the panel.
Thank you.
Next up, similarly, we have Mr. B. Ramesh Pillai from India. Mr. B. Ramesh completed his Bachelor's of Optometry from Elite School of Optometry, postgraduate certificate in business management from XLRI Jamshedpur, and is a fellow in BCLA, a British Contact Lens Association. He started his career as consultant optometrist in LV Prasad Eye Hospital, Hyderabad, and then took up a corporate job where he worked for multinational companies like Bosch & Lomb and Titan. We welcome you to the panel, Mr. B. Ramesh.
Thank you.
Next up, similarly, we have Mr. P.S. Rekhi from India. He completed his bachelor's in optometry from Elite School of Optometry, Chennai in 1990 and underwent American Optometric Association accredited advanced contact lens training program in New York, USA in 1991. He then completed his advanced training in clinic of Dr. Khan Chatwal and Dr. Jim Wilkinson in Canada with special emphasis on learning disabilities and dyslexia. He has worked as honorary optometrist to the Spastic Society of India and Down Syndrome Federation of India, and is key opinion leader for multinational companies such as Johnson & Johnson, Vision Care, and Alcon. We welcome you, Mr. Rekhi.
Thank you.
Next up from USA, we have Ms. Ukti Vora. Ms. Ukti Vora completed her master's from Lotus College of Optometry, India, and MBA from California State University, East Bay, and is also a fellow of American Academy of Optometry. During her 9 years of work experience, she has worked in a variety of roles, including senior clinical optometrist, faculty, researcher, and key opinion leader for Cooper Vision, India. She's also a director of clinical affairs for an ocular telehealth company based in United States and runs a podcast channel called NerdyOptometrist. Ms. Ukti, welcome to the panel. Next up from Sri Lanka, we have with us Mrs. Kumari S. Fonseca. Mrs. Kumari is an optometrist and certified orthoptics working in Sri Lanka and is currently serving as Group Director of Professional Health Affairs and Vision Care Optical Services Private Limited. Mrs. Fonseca, welcome to the panel.
Thank you.
Similarly, we have Dr. Pawan Baral from Nepal. Dr. Pawan graduated Bachelor's of Optometry from JIMS, Chennai in 2009 and Masters of Public Health from Salus University, USA in 2018. He has a vast experience of having worked in different roles within community eye hospital, private optometry practice, as well as INGOs. Recently, Dr. Pawan moved into his hometown Pokhara and joined the local eye hospital as a research officer. Dr. Pawan, welcome to the panel.
You.
So without further ado, we will now jump right into the discussion. So I'd like to ask my first question to Dr. Shyam. Everyone is in dilemma after the completion of bachelor's or master's in optometry. So what do you think is the main reason behind this?
Sorry, repeat that question again. Whoa.
Yes, everyone is in dilemma after their completion of bachelor's or master's in optometry. So what do you think is the main reason behind this?
I'm going to talk from a personal experience. When we joined elite school, we were the second batch that was graduating. We had no clue what role we were going to play in the society. There was paranoia, there was fear, we felt very insecure. What are we going to do? Are we going to work in optical stores? Are we going to start our own business? What career pathway? Because we didn't have anyone to guide us. So we went through that ordeal. I think today optometry has evolved even in India and in the SAARC countries to exponential growth, both from a career point of view, and I've seen optometrists succeed in every field, be it the corporate world, be it working in a hospital, having your own practice, going into academia to teach. So they're able to wear different aprons. So I think today optometry is not what it was when we passed out in 1990. So I don't think they should have any dilemma now. They should have a very clear goal, a very clear pathway as to what they want to do. They have various options, like you can get into private practice, you can go on to do further studies, or you also have the option of working with, until you start your own practice, working in established practices, or also the corporate world is another option. So I think today a lot of apprehension is being. We are now able to mentor these upcoming these new graduates.
Thank you, Dr. Shyam. I would like to ask Ms. Ukti the same question. What do you think is the reason for this dilemma between bachelor's and master's students?
I feel, just to add on what Dr. Shyam did mention, is of course, things have been much better, I would say, from his generation to even mine. When I graduated and I passed, we did have a lot of clarity. But I feel one of the reason behind dilemma, according to me, would be defining the reason why. Like when you're doing masters, there should be some clarity on why you are doing it. Is it just because everyone is doing and being part of the trend, or you have a reason behind pursuing your masters? I think if the students have some clarity on that, it will make it easier for them. And it might also be an option for them to explore. As he mentioned, there are so many career options. So you can start with something and do not hesitate to switch, because I feel optometry has been one of the blessed profession where people can be part of multiple profession. It could be academia as well as, along with your private practice. So if they have a little clarity on the why, and if they're ready to explore, I think the dilemma would come down a little bit on that side.
Thank you. Next question I would like to ask to Dr. Pawan here. Most of the optometry students, when asked about reason for joining optometry course, say that it is considered to be second option to MBBS. So what do you have to say about that?
If you ask me through my personal experience, then yeah, well, in Nepal, I do feel that students keep optometry as their second option because MBBS always comes as first option. Be it coming through the society or coming through the family or coming through the perspectives that you see in Nepal. Yeah, many students after their high school they always opt for MBBS, and then if they don't get through MBBS entrance examination, then they go and try optometry. If not in Nepal, then they most of the students these days they go to India because there are a lot of options of optometry schools in India. When I studied in 2009, there were a little options, all the more than the only college in Nepal. There were several colleges in India I could go to, but then these days in every city of India there are multiple optometry schools teaching optometry. So yeah, it is due to the society, due to the job perspective. In Nepal, students keep optometry as second option after MBBS.
Thank you, Dr. Pawan. Dr. Keshav, do you have something to add to this?
Well, this is not new. This has been going on for generations. I come from a family of physicians myself, so there was this big demand for shoes to be filled. My siblings tried for medical school. They didn't quite make it, and the pressure was on me as well to consider medical school as an option. But it is rooted in societal demands, the changes in politics at the given time that you're pursuing your education. So for me, medical school was not my first option. Uh, as we were finishing up and trying to look forward from 12th standard, I was the first batch of the 4-year optometry program started by Shankar Netralaya. So my family was aghast that I even considered this as an option because it was just completely new. There's no such thing as a 4-year. It was called a baccalaureate in optometry. So the word baccalaureate itself seemed foreign, which it is. So in all honesty, my family was against this decision of me joining this program. And yet, there are some career decisions we make, and what we make of the career decisions is a second factor. So the demand primarily by societal pressure is medicine, but I think with the direction carved by the subsequent batches of optometry students coming out of all these excellent schools have shown that it is not to be seen as a secondary career. I think it established firmly and very clearly that there are plenty of avenues open to us, and it is up to the individual to kind of make the best of what's thrown at them. So I'm happy to see that different schools are coming up with lots of programs, but I think primarily, and I've seen this time and again, there has to be a strong association. If the association has enough political power, then I think we can make a huge impact in society. The fact that optometry is a giving organization that helps a community in a big way is unquestionable. How we make of it comes from a variety of forces. So many youngsters, I think, have taken upon themselves in India to form strong associations. So we should build upon that strength and make it like a preferred profession to move into as opposed to a secondary choice. So that would be
Thank you. Thank you, Dr. Keshav. I would like to ask next question to Mrs. Kumari here. Mrs. Kumari, so how is optometry practice in Sri Lanka? Is it also considered to be a secondary option after MBBS? And who is eligible to practice optometry related tasks there? Ma'am, if you could unmute the mic.
As other countries, after MBBS, paramedical, everyone is trying for paramedical, and for the optometry also one of that. But in Sri Lanka, since optometry as a profession is not very common, so only youngsters who really want to be an optometrist enter this field. And instead of looking for a job after completing, they aim for the job before they study. So as a result, they will get employed immediately after graduation.
So do we have courses of optometry in Sri Lanka?
Yes, there are a few organizations and the government. We have optometry programs running up. Yeah.
And is there any governing body that regulates the practice?
Ceylon Council of Optometry and Orthoptics has been formed to regulate optometry and orthoptics in the country. Processes are underway, and I am confident it will be recognized very soon.
Thank you, Mrs. Kumari. Next question I would like to ask to Mr. Rekhi here. Beside clinical options, what are the other career opportunities for optometrists?
No, I think besides the clinical options, of course, there are opportunities for you to work along with multinational companies. I think the lens manufacturers have a professional team which people come to us to describe different types of lenses and the training capabilities of your staff, etc. You have today people from contact lens companies who hire a lot of optometrists. You've got these multiple retail stores today who employ people for training purposes and for maintaining quality standards and standard operating procedures, etc., for their own clinics and building up the standard of optometry in these practices. And I think there are many options. I think basically to go back to the first question that you had asked Shyam, is what he answered was very true, because none of us, Keshav's batch was the first batch, I think Ramesh, Shyam, B was the second batch. None of us knew what we were going to get into because it was a completely open sea for us. And each one of us, I think, in our own way, has sort of managed to do certain things. Why aren't the current students doing something, I can't figure out, because there are enough of us who have shown different things that can be done. So
Thank
there are
you.
plenty of options. Thank you.
Thank you, Mr. Rekhi. Ms. Yukti, would you like to add something here? Ma'am, mic.
Sure. Yes, definitely. I think what Dr. Rekhi, Dr. Shyam, Dr. Keshav, they definitely have set a path for all the optometrists, the younger optometrists out there. And I personally feel beyond now, with the technology coming in, there is another opportunity of careers for the optometrists to contribute in technology as well, because with new technology comes a lot of responsibility on the optometrist to make sure how is that being implemented. So it's not just clinical research optical, but you can actually be part of these innovation organizations or the companies and be a consultant for them. So I think there is definitely a lot more that you can do. And as I mentioned earlier, you can do multiple roles. You don't have to stick to just one option.
Ms. Yukti, you have done MBA after your bachelor's, am I right? So
I
in
did
what?
after my master's, actually.
Oh, I'm sorry. So you have done MBA after your master's in optometry. So in what ways do you think it can be helpful? And can a science student, a student with a science background, can they cope up with the management knowledge required to do an MBA?
I would like to answer your second question first. I feel being a medical student, you definitely can cope up with management studies, especially because you're so used to studying at least 8 hours a day. I think you're already drilled. If you're studying in India or in Nepal, I'm sure you're already drilled in studying and being a more geek or a nerd. So I don't think the studying would be a problem. And the biggest advantage, what I feel, is optometry as a course is fantastic, but we do not learn the business side of it. So anyone who wants to learn and be in the corporate, I feel MBA definitely gives you a larger perspective to look at a whole picture than just one thing of, say, eye care or optometry. So there are two ways. Definitely you can learn on the field. It's not a compulsion to do an MBA, but MBA gives you a kickstart if you want to go into a management role and be part of those kind of career options.
Thank you, Ms. Yukti. Dr. Pawan, in what ways is public health degree helpful in the field of optometry? I'm sorry, Dr. Pawan, your mic.
So studying public health, it actually depends on what you want to do after public health and then what are your career scopes. So when I first completed my bachelor's in optometry from India, I was not actually sure if I wanted to do public health. Actually, truly, honestly speaking, public health was one of the subjects that I did not want to study. There were several reasons for that, but then once I started my practice in community eye hospital working in far eastern Nepal, then I realized the problem of visual impairment and blindness in the society. And then although I was practicing optometry, I was not practicing core optometry skills, doing refraction, binocular vision, and then contact lenses only. But then I was also going out in the community and then examining people there, patients there, and then bringing them to the hospital and helping out other professionals like ophthalmic assistants and ophthalmologists. I was also involved a little in training refraction to eye worker trainees who worked as assistants to ophthalmic assistants and ophthalmologists. And then after that, for some reasons, I wanted to get some international experience and move to Maldives, but it was private practice, and then I was not really interested in working there. After I started working for a few months, I was looking for other career options while I was working in that private practice. Then I joined Fred Hollows Foundation and then moved to the Pacific region. And then there I started training eye nurses. And then I was also involved in training refraction and then low vision to ophthalmologists in those countries. Then there I realized the impact that I could make as an optometrist, developing the future leaders in those countries where they lacked ophthalmologists and then eye nurses. There were in some of those countries there was not even a single ophthalmologist and not even a single eye nurse. And studying public health, I got all those skills through which I could actually plan strategies and then develop these programs through which we could train eye nurses and ophthalmologists. And not only that, but then I could also assist those countries in developing their national eye health plan. And when we look at these documents from World Health Organization and International Agency for Prevention of Blindness, they have developed these guidelines for working for Vision 2020, and Vision 2020 is getting over, but then they are developing other new programs through which we can combat visual impairment and blindness in the world. So when I did public health, the way I looked at patients actually changed. I was not looking at patients to just diagnose the diseases and then the conditions they had, but then I was looking into preventive aspects of those. So I was actually working on how can I reduce the number of patients coming to the clinic, in those with those serious conditions, or in other way, I was also looking at ways how could I make this eye care, accessible to everybody in the community. So public health has got many advantages that way. But then when you look at the financial side of it, which many optometrists and then which many graduating optometrists would like to know about, you don't make much doing public health optometry. There is much more in clinical optometry.
Thank you, Dr. Pawan. This next question I would like to ask to Mr. Ramesh Pillai here. So you have been involved in various multinational companies. So in what are the various different ways that an optometrist can be involved in multinational companies, and what are the task skills that those companies demand?
Yeah. So yes, as soon as I completed my optometry, I had gotten into a clinical practice with LV Prasad Eye Institute. In fact, Dr. Shyam and myself, we were together in LV Prasad. And I think after having worked in LV Prasad, it's there that we got exposed to the corporate world. Dr. Rao has been kind enough to give opportunities for all the optometrists who work in LV Prasad. So hence, we were given an opportunity to, sort of get an exposure towards multinational. And that's how the corporate career began for me. And uh, it's pretty exciting in the corporate, field, because you're always on the move, and you're actually sort of using your knowledge and skills to impart training to the sales team. And also you get a huge satisfaction in training the practitioners, sort of to dispense your products, to sell your products. And when you look back, actually you feel that you have contributed a lot to the society through being in a corporate, wherein you have sort of tried educating a lot of people about eye care, the products related to eyewear. And also there's a huge contribution that you can make in raising the overall quality of the eyewear in the country. So coming back to your question of what are the opportunities that exist in a corporate industry, there are immense opportunities. You could, if a person is right now, I'm sort of heading optometry and training in Titan Company Limited, and we are sort of the India's largest optical retail chain, and we have close to 580 stores spread across 210 cities. And so if the optometrist wants to get into clinical optometry, yes, they can join the optical retail and take up clinical work. And along with the clinical work, they would also sort of get exposed to the dispensing opticianry, because in any optical store, dispensing opticianry becomes a very, very important aspect of optometrist job. So that is an added advantage that you get, and which could eventually help an optometrist in getting into their own practice if they eventually want to, because that's one of the dream of every optometrist who take up this curriculum, that you would want to one day you would want to have your own practice. So these sort of exposures would definitely sort of groom you to achieve your the final ambition. And so once you get into large corporates, then the growth is assured, provided you give it some time, because these days the millennials are a bit restless, so they normally expect results to happen very fast. But then in any corporate organization, the organization would try to sort of assess not only the knowledge and the skills, they would also look at how dedicated and how dependable the person is before they move you into the next role. So hence, my request to all the budding optometrists, the optometrists who are passing out of their colleges, should give it some time and sort of think what exactly do they want to achieve in life, and then they could sort of choose the various fields that they want to get in. So I would say that it's important that one follows the heart, one follows the passion, the field that you want to be, and that is what should drive you to choose where you want to sort of step in and build your career.
Thank you, Mr. Ramesh. Mr. Rekhi, you have also worked with multinational companies. So in what ways do you think an optometrist can be involved in this? You have already spoken about it, but I would just like you to go a step ahead and elaborate a little bit in what ways optometrists can be involved in this, and what are the task skills that these companies demand?
So my experience in the corporate world is based because I've been successful as a clinician, and they look at me as in the sense that if I endorse a product or I teach something about a product, people will tend to listen. So there are different methods that this happens. So there are certain companies who want you to endorse their products. There are other companies which would just have you as a teacher, and you can talk about any product that you want to. Of course, they have the banner behind you. And these are the kind of companies that tend to prefer to talk for them. And a lot of them are involved in training optometrists to achieve different levels of clinical skills. It could be contact lenses, it could be basic clinical skills, or whatever. So there are different training programs that they have: level 1, level 2, level 3. And you work along with hospitals, you work along with colleagues, you work along with a lot of other people. Sometimes it's people who have just stepped out of optometry school, some people who've been into practice and want to get onto new types of contact lenses, etc. And you help teach practitioners how this works. And because you're a clinician, I think your perspective on the whole thing becomes a lot different. So my interaction with corporates is more in that way. That is, again, to reiterate the same thing. You have to first be a successful clinician before they take you seriously. And obviously, if they want you as an opinion leader, your clinical value is of essence. You're not actually marketing their product. You're actually talking about how a particular variety or a particular category of product is perhaps useful for your patients and upgrading skills.
Dr. Shyam and Dr. Keshav, I would like to come to you now. You have successfully made a practice outside of your country in USA and in Canada. So how did you go about it? And there are a lot of youth who wish to start up their practices in those countries. So what would you say to them? Dr. Shyam. Sir, Mike. Sir, Mike.
Can you hear me now?
Yes, sir. Yes, sir.
Okay. My apologies. I think initially I didn't start out my career thinking that I'm going to be on my own in a private practice. I did switch roles. I was in the corporate world for a long time. I'm going to add what Ramesh and Rekhi said. Like, I spent time with Bausch & Lomb, and I also spent some time with Essilor in North America. So I was traveling all over North America, training people on progressive lenses, troubleshooting people who have non-adaptive progressive lenses. So my role was with Essilor into training on new progressive lenses, how as optometrists, some of the training that optometrists go through in their academic curriculum is very clinical oriented. So the hands-on is what the corporate world was giving them. So I was talking to one of the panelists was talking about how an MBA is a value addition to optometrists. But in fact, the vast majority of medical doctors in Canada now have an MBA. The simple reason being that the management degree gave them that entrepreneurial skills, which perhaps in the medical school or in the optometry school they didn't learn. So with my experience in the corporate world gave me those tools that when I started my own practice, I had that advantage of having that learn those entrepreneurial skills. So I would suggest anybody who's starting new, first, people like Rekhi, who's already been in practice, use them as role models. Go into their practices, see how they are working, and perhaps work for a few years with some leading optometrists, or like Ramesh was talking about, those big chains, before you actually venture out and start on your own, because you will then know what kind of an investment you want to get into, whether you want to, like my practice is, I do not dispense. I'm not mine is a purely clinical optometry practice. I work with a team of doctors. Mine is the medical optometry side of it. I do not dispense glasses, or I'm only starting doing contact lenses now for myopia management. I do not dispense contact lenses. So mine is the medical side of optometry. But I think for any new student who is coming out, for them to navigate through this process, I think it's better that they get their feet wet by going and working with somebody, or working in some established practice or in chains, and then see what they want to go about, whether they want to go into a setup where they have a full-fledged optometry setup where they dispense glasses, contact lenses, and have an entire primary eye care practice. I think that is what has helped me. I did not start immediately after I spent substantial number of time learning before I started on my own. In the last 14, 15 years, my private practice has been very rewarding. I think most of the optometrists who graduate will realize initially there's a fear that apprehension will give way to optimism. They will do well. Eventually, we have all succeeded in our own way individually. In Canada, the optometrists are the primary eye care practitioners. Every patient has only access to an optometrist as their primary eye care professional. Even unlike in the States where they can go to an ophthalmologist, they can't. They have to go to the optometrist, and it is we who will decide if there is any surgical needs that we refer them to an ophthalmologist. So there's a lot of onus on you. You are taking over the entire responsibilities of eye care to your patients. So it's been professionally rewarding 14, 15 years, but this journey that of having started on my own, I couldn't have dared to do it immediately when I graduated. So I went through those process of learning. I took one step at a time, before I could go. One step is why you take to cross a mile. That's my takeaway from my journey. I'm sure Keshav will have something to add to that.
How was your licensing exam experience in the University of Waterloo? So what is the licensing procedure now if anybody from South Asia wants to settle in Canada and start up their practice?
I think like in the States, we have an accelerated program where you could, depending on your skills. So there have been students who have come from New Zealand who have done some master's program, and for them, the transitioning is a little more easier in about 12 months. So it's very different. We have, sadly, in Canada, we have a lot of ophthalmologists from various parts of the world. I have trained about 3-4 ophthalmologists under me itself from different parts of India who have gone into optometry program, because the role is very similar. The only thing we don't do is surgically this. In the States, a lot of optometrists do laser treatment as well, and Keshav will add to that. He knows. So it's about between 1 to 2 years will be your bridging program. And that is what is even for dentists who come from India to become a dentist here. The University of Toronto has a bridging program. So depending on your skills, if you have done a master's and you have done teaching, it can take between 12 to 24 months to become a doctor of optometry.
Thank you, Dr. Shyam. Dr. Keshav, what was your experience, and what would you suggest any South Asian student who wish to practice in USA?
Things have changed a lot since 1989 to where we are currently, simply with the introduction of internet. When I was in school, we had faculty that would come from University of Berkeley on a 6-month rotation. It was fascinating for us because there was no such thing as optometry educators in the optometry schools. So to have access to publications and see the scope and practice skills of optometrists from North America was just simply mind-blowing. At the same time, the opportunity to provide a certain level of medical care that was unprecedented at Shankar Nethralaya was also absolutely immeasurable. So when you get out of optometry school, one is very young, and it is not exactly clear where your preferences are with regards to seeing clinical care, whether it's in a corporate career or if it's in teaching, and these are all options available. So my first thing would be, if someone's thinking about practicing in the US, first question would be to simply, when you get out of school, try and explore these options by getting into, say, a clinical position, see if you like it. See if there are some opportunities to talk to somebody in the corporate industry and shadow them for a few months to see if you like that. As far as I was concerned, my breakthrough came through a scholarship that I got to go to New Zealand to pursue a master's degree. And interestingly, the degree was in visual psychophysics, something that was unheard of when we started out, and that had to do with the effects of contrast on the accommodative drive. So the entire process was new to us. It was not something that I chose to do, but when I arrived in Auckland, New Zealand, I was assigned a professor, and there was a bunch of projects that we could pick from, and almost all of them were in visual psychophysics, and that's the direction I chose to go in. In the 2 years that I spent doing my master's degree, although I thoroughly enjoyed every second of it, I sorely missed this ability to communicate with patients and be able to solve real-world problems. In 1989 and 1992, there was no such thing as a unified association of optometry for Australia and New Zealand. So they had no idea of this concept of an overseas candidate coming in to practice optometry. So they created a subset where they said, well, you could teach in the school to students who are graduating, but we don't have a methodology to give you a license to go out and practice, which was incredibly frustrating. Of course, things have changed a lot since then. They have some unified examinations between Australia and New Zealand that you can take a test and qualify to practice and so on. So I'm not sure if I was the first, but it seemed to me like I was one of the very first students to pursue this option. So even though I graduated with a master's degree from the University of Auckland in New Zealand, I was not able to practice clinical optometry, but interestingly was offered an associate professor position as a teaching faculty in school. So I was responsible for running all the clinical labs for first year, second year, and third year students, but did not have an opportunity to go into the fourth year. So such was the situation then, but then I was itching to continue clinical practice. So I had bounced back and forth between practicing in Singapore for a few years, where I had a contact lens practice, and moving back to New Zealand to continue my academic work. And there was this fire burning in me that wanted to see patients, and secured admission at the New England College of Optometry for their transitional program. As Dr. Singh was saying, it's a 24-month program going from summer to summer to summer. And arrived in Boston in '94, but of course, the financial pressures of being able to pay for such a program is enormous. Very quickly realized that it's not practical to do so, and returned back to Singapore and again to New Zealand to continue squirreling away some money. Interestingly, the years that I started this exploration in mid-1990s, the fee was under 20,000. And by the time I got back to New England College of Optometry in 1999, the fee had almost doubled. So, financial considerations are significant. So the path that drove me was this continued desire to want to do A, B, or C. So drew out a map and kind of continued to work on that. And first step is the most important thing, and you just keep putting one foot in front of the other. So when I got back to New England College of Optometry, they were kind enough to keep my admission open subsequent years between 1994 and 1999, knowing my financial situation. Then it was a 2-year program. At the end of the first year, you're expected to take Part 1 boards, which is the National Board of Examination in Optometry. Upon completion of that, then you continue on to your clinical work, and towards the end of the second year, you're expected to take Part 2 and Part 3. Part 2 is written, Part 3 is practicum. So once you finish that, then you're given a certificate of completion. But because optometry is heavily regulated by state boards, the option to prescribe pharmaceuticals and laser procedures vary from state to state. So then you have to take each particular state exam, and the state exams vary depending on whether they allow such procedures or not, to simply understanding the laws of the state as opposed to being able to do certain procedures in the state. So I am currently in North Carolina, which is one of the most highly regulated states, where you have to take another written, oral, and a practical test. And once you complete those tests, then you become certified to practice in that state. I cannot practice across state lines. So that is the long journey to get to where I am. Happy to answer questions.
Thank you, Dr. Keshav. So what is the governing body that overlooks these exams?
Yeah. Oh, there's a National Board of Examination in Optometry. It's called nbeo.org. So they have an accredited system, and their headquarters is, in fact, interestingly based in Charlotte. I am a clinical examiner for the National Board of Examiners in Optometry. So I evaluate students now here in Charlotte that are qualified to go out there and practice. So their entire core message is available on their website. So look up nbeo.org.
Thank you, Dr.
They are the ones who decide what needs to be done. Yes, and each state has its own. So of course, you have to cross the first step before you get to the state level examination. So I'm a trustee on the state board also here. And we'll talk about political issues when we get to that point.
Thank you, Dr. Keshav. I'd like to ask, would you like to add something, Ms. Ukti?
Yes, I think I definitely have a different perspective to, piggyback on what Dr. Keshav did mention. Definitely when I moved to United States 4 years back, for everyone to know, and even I was very passionate and I wanted to restart optometry as my career in a different country. I did apply in NICO, and I did see the entire financial baggage that comes along with it. And there is another perspective of it is the work permit and the immigration laws, which is like a different topic altogether. But that was one thing which did hold me back, or whether it is worth it when you're evaluating your options. So I did apply, I did try. Unfortunately, I did not get through in the first year, and that got me thinking, what are the other options for me to explore? So I did started working as an assistant to an ophthalmologist in United States to understand the practice here. And for people who do not want to go that exact route, there are options, as you can be a certified optician, you can be an ophthalmic assistant, and you can be a contact lens practitioner as well, to work in optical outlets. So I did explore those options just in case if I'm not able to, practice optometry again here. And that got me thinking, whatever I have practiced, learned back in India, it's still the same. I do have the clinical knowledge and expertise, and how can I, encash that knowledge in a different country? That was my perspective. And that's where I did MBA, to know the business side and see if I can contribute on the technical as well as the business side of a corporate life in United States. So I went that route. I did not, pursue my optometry. But if you are ready to, explore, juggle around, but you, as Dr. Shyam also had mentioned earlier, you have to go one step at a time. So I did work with an ophthalmologist for a year. I worked with an optometrist for 6 months to know how is the practice in United States, because the laws are different, the rules are different, the scope of practice is very, very different than what you see in India. So once you get that side, I also worked with Oakley as an optician for a year. So you learn the retail side as well, and then you find your space, where can you fit in. So yes, if you can be an optometrist in United States or Canada, it is definitely rewarding. But there are other alternatives that you can explore in case, if you're not able to go in those routes.
So Ms. Yukti, you are also a fellow of American Association of Optometry, am I correct?
Yes.
So what was that journey like, and what was the impact on your professional career of that?
So I actually I did my fellowship in American Academy of Optometry when I was actually practicing in India. So I had that before I moved to United States. And luckily I had mentors around me who did walk me through that process. And it was one thing where I realized that once you have those kind of fellowships, you have a different exposure to the options that are available. Like even for me, when I started, moving to United States, one, you get networking options. Second, you learn the scope of practice in different country, and I think that's how it helped. Again, American Academy do offer a lot of educational resources to update your knowledge. So those were a couple of perks of being a fellow and working and collaborating with people internationally once you become a fellow of American Academy of Optometry. So I think those were the perks that I was looking for, and it really worked well for me.
Thank you, Ms. Yukti. Mrs. Kumari Fonseca, I would like to ask you the next question. So what are the roles that an optometrist takes on in Sri Lanka, and what would an optometrist in Sri Lanka would look forward to regarding their future prospects in optometry?
In Sri Lanka, all the refractions are done by optometrists. And additional to that, all the diagnostic test, because we have a different method of doing these things compared to other countries. I think this is something unique to Sri Lanka, because we do all the diagnostic side, including biometry, contact lenses, and OCT, fundus photography, FFA, like that. So optometrists are doing all these things. So after our graduation, we do the continuous education and then learn other things. So we optometrists are once we do the testing and we refer them back to the ophthalmologist, and ophthalmologists hardly do any refractions. So we have a very good relationship with them. And additional to that, now another 2 BSc programs will start soon in Sri Lanka, and other fields, existing fields also improving, like myopia progression, sports vision. Now recently we opened our sports vision center the first time, and vision therapy started a few years ago. So I will encourage anyone to do optometry, because there is a bright future ahead of them, because with improved technology, many new fields and opportunities are opening up. So, and there are so many optometrists in the country at the moment performing well with the administrative positions, and they are performing very well. So continuous education is very important. And and we also have our own academy which we produce optometrists, and we have a training programs for so I'm also basically optometrist, and then I become orthoptist, and now I learn vision therapy, sports vision, and so there is in front of us, I think there is a huge opportunity. So I will encourage anyone to study optometry.
Thank you, Mrs. Fonseca. Next question I would like to ask to Dr. Pawan here. So you have finally returned to your home place of Pokhara. So, and you're practicing there in the local hospital. So what are the challenges that you are facing now as an optometrist, and how would you handle it?
Thank you for the question. Challenge is when you look at me, I have joined the local eye hospital, Himalaya Eye Hospital, where they have started optometry training, and this is the second optometry school in Nepal they started last year. So the number of optometry students has increased in the country. And when I joined this hospital, I joined as a research officer, and I was not sure what I was going to do, when I returned to my hometown. But then fortunately there was this position open in the hospital, and I applied to that position and then somehow got through the selection process. And as I joined, I found that the hospital was looking to do more in research, and then basically it is the ophthalmologist who are working there, and then the optometrists who are also the faculty optometrists there. They also wanted to improve in the research, and then as the eye hospital has developed into an institute for training optometry students, the research practice had to increase there. So I have joined the hospital, but currently I'm not doing any clinical practice there. In my past work, in the last job I resigned from, I used to be working both in the clinic and then in the classroom teaching eye nurses and then doctors, and I was also doing management, managing the academic program there, doing advocacy, networking, and all sorts of things. But then here I'm not doing any clinical practice. My job responsibility does not allow me to do the clinical practice there, so I'm missing that in a way. But then through research, when you do research, you do have to see patients, and then it, it is all because of this COVID-19 that has been delayed a little. So in terms of challenges, coming back to Nepal almost after 8 years, there have been things changed in the society, in the market, and then optometry scope. But then when I go and look at the hospitals here, I guess they are still the same. Nothing much has changed in the hospital, so there is not much of challenges there, except for me to work according to my job description and then try to help the hospital to improve their research capacity.
Thank you, Dr. Pawan. I would like to ask next question to Mr. Ramesh here. So if you would be hiring any optometrists, so what set of skills would you look in them?
Yes. So thank you for asking this question. So from the corporate optical retail chain, what we actually look for is primarily the knowledge and the skills. And we basically look for the basic knowledge and skills, but what is more important is the attitude part, the willingness to learn, the willingness to grow, the willingness to contribute. Those are more important aspects which we look into, because the knowledge and skills we definitely can impart, and we can sort of bring them to the desired level that the organization wants. Because whomsoever we recruit, the optometrists at the store level, we actually put them through 1 month induction training, and this training has been sort of co-created with Shankar Netralaya, and together we impart this training. So what is more important is, while the knowledge and skills are the basic aspects with which the optometrist comes in, what is more relevant is their ability, the attitude, their willingness to learn, and also a bit of communication aspects, like how good are they in communicating, how good are they as far as the soft skills are concerned. So these are some of the areas where we would actually want the students to focus, and that's what the entire industry is grappling with. Because when we get the students from the institute, while they have the basic knowledge about optometry and how to do an eye test and how to do an eye examination, what they actually lack is how to communicate, especially when it comes to doing the history taking, or trying to understand the customer's lifestyle, trying to understand also to emotionally connect with the customers. Those are things which are more relevant in a practice. So those are things which we actually look for in a candidate when they come into. And as I told earlier, when they get into a retail store, they may get in as a clinical optometrist, but then based on their performance, the opportunities open up. They could even become eventually a store manager, managing the entire store, the team, and then they also have an opportunity to take the role of a regional optometrist who could take care of the one region as such. And if they are interested, then they could even get into training, and they could get into sales, So the opportunities just open up depending upon the optometrist area of interest. And we would also, sort of, if they are interested in getting into the clinical side of it, then yes, we as we move and as we evolve and as things change, we also look at, how can we get in the specialty practices into our stores. So there would be opportunities for, people who are clinically inclined to get into specialty practice as well. And not to forget, we also have manufacturing, labs. So optometrists interested in getting into the technology aspect can also get into, the product and marketing side as well. So the opportunity is immense if they get into a corporate, setup. And as I mentioned, they need to come in with the right attitude and the right set of skills. And that is what the organization looks for.
Thank you, Mr. Ramesh. Mr. Rekhi, students often fellowship programs after their bachelor's, and a lot of us are confused whether to go for master's or for fellowship. So what advice would you give us?
Should they do a master's or a fellowship?
Yes, and for the either options, what should the students consider?
I think you have to first decide where you want to be 10 years from now, and then figure out whether a master's is better or a fellowship is better. For example, if you want to get into academia, then obviously a master's gives you better scope for, or a PhD, or gives you far better scope for a better salary at a certain point, and so on and so forth. I think if you want to get into, let's say, a clinical practice, then you figure out whether you have the skills that are required for the kind of practice you want, and then start going about to acquire those skills. Whether you do that through a clinical master's program, or do you do it through a fellowship program. Either which way, whatever you want to do, I think you need to finish it off as quickly as possible and start your practice as quickly as possible. That's the best advice I could give.
Thank you, Mr. Rekhi. Dr. Shyam, would you like to add something to it? What would you advise the students? Is fellowship a good option? And in what situations do the students need to consider fellowship?
I think Rekhi rightly summarizes. See, if you want to go into a clinical, you want to take on a clinical role, or as an optometrist, you want to start your own. You have to, when you graduate, you'll obviously have certain areas that you want to develop your skills on. It could be learning. See, with all these new electrodiagnostic tools like OCT, now we can actually preempt macular degeneration even before we see drusen through a new testing called through dark adaptation test. So there are various new things that are happening every day. I didn't even know about this until a few weeks ago, that I can actually, even before drusen comes in the posterior pole, or what I can see on the ophthalmoscope or OCT, I can actually pick up by doing the dark adaptation test. So if you want to learn those clinical skills, I think fellowship is the best thing to do. If you want to get a hands-on perspective, for you to have all the tools and the skills to start your own practice, I think fellowship is a rule. But if you want to go into academia, into research, or even it probably will give you to do a master's degree, it will also help you into the corporate world, because I have quite a few of people that I train who have gone on to done their MS and now are into research R&D roles in Alcon, in big companies. They are all in, I think that is one area that we somehow missed, is a lot of optometrists are key, like Rekhi, from a clinical point of view, he is giving his feedback to the companies, but within the companies itself, there are optometrists who do research and development, who are on the forefront of technology, developing new products for us. So if you want to go that route, then I think masters would be the route, whether you want to go to academia or you want to go into research. Research can be within an institution or in the corporate world as well. You go there. Otherwise, I think a fellowship program will give you all the tools to sustain and to survive in the clinical world, where you start yourself as, as a optometrist, as a primary eye care practitioner. So you can
Here, I would just like to take a question from audience. Ms. Nikita Sethi asks, is if it is preferable to do a bridging program or an OD program in Canada after pursuing Masters in Optometry from India to be able to practice in Canada?
I think one of the panelists was talking about there are other key things is also what is your status that you come into the country. So the bridging program is only for Canadian residents or permanent residents or citizens. So if somebody is coming here as a permanent resident, it's easier for them to get into the bridging program. So sometimes people come here to do a master's, and in 3 years, by the time they finish their master's, they have the permanent resident status, and then they can go to the bridging program. So it all depends. If you come here as a permanent resident, you can straight away go for the bridging program. There is a very like what Keshav talked about, NBEO, we have a very similar exam. It's almost equal to that. It's called CSAO, which is Canadian Standards Assessment in Optometry. It's a 2-day intensive exam. So they do an evaluation exam, and then they'll see where you are, and then they'll tell you what kind of a bridging program, whether you can do it fast track between 12 to 15 months, or you have to do a 2-year program. But it all depends what is your status you come here. If you come here as a permanent resident, you can straight away go and do your bridging program and go on to become a doctor of optometry. But if you come here as a student, then you have no choice. Do a master's until you get your status as a permanent resident, and then you can go and do your Doctor of Optometry program.
Thank you, Dr. Shyam. Dr. Keshav, research is also considered as one of the fields where optometrists can practice. So can an optometrist carry independent researches on their own?
Independent research on their own, I don't think is an option. I don't even know what that means. So to be able to carry research of any nature, there are multiple levels of scrutiny that needs to be put in place, whether it is ethical issues or if you're doing animal models for research, there has to be certain recruitment processes. So independent research by oneself is not an option. It either has to be associated with a research institute or a private enterprise or an educational institution. Does that make sense?
Sure. No, so the lot of researches in a lot of places, the optometrists usually do in sync with ophthalmologists. So in that regard, what do you have to say about that?
We practice in sync with ophthalmologists all the time. We are considered in North America as primary care providers for eye care, and we are on parity with physicians. So people seek us for practically all first level eye care. And the ideal situation is for us to triage it and decide what direction the patient has to be sent if it is beyond your scope of practice. And the scope of practice will vary from state to state. So patients seek us out for as their primary source of information and care, and most instances we are able to take care of it. If and when it goes above and beyond our level of skill, then we have to find the right kind of specialist to send them to. So as a practicing optometrist here, we have heard all of these avenues for being in the industry versus being a researcher and so on. I think I have been fortunate enough to be involved in practically every sense of this, even to this day, including public health, because when we see somebody as healthcare providers, we take care of the person's health. Optometry should, I think, stop seeing itself as a vision care provider or an eye care provider. Having a broad scope like this allows for us to see beyond what can I do in a limited area of work. And the graduates that are coming out of optometry school now can be seen in all areas that we didn't even think possible. There are some students that are coming out that are doing some fantastic research on the biophysics of the cornea or diabetic research and so on, which we didn't think was practical. Now, when I am in clinic, I don't limit myself to recommending eyewear and contact lenses. I have a few minutes discussion on the benefits of cessation of smoking, the risk to macular degeneration from certain habits that patients have. I talk about the benefits of nutrition and diet as part of my diabetic counseling. So I think, then because of my industry connections, I am able to be what's considered a key opinion leader on contact lenses. I have the opportunity to talk about lens designs through Zeiss, who we use in our lab. So I think the options are plenty. So independent research may not be possible. Independent work aside from an ophthalmologist is not practical, but I think we coexist and we find avenues. The reason why many of these people are on the panel is because we've all found ways of making things happen and possible. So I think the current generation that listens to this shouldn't limit their possibilities. They should say, you know what, we could build upon the strengths that these folks have done and do even better. So there are plenty of opportunities to explore.
Okay, here I am again taking question from our audience here. So our audience are students especially are mostly confused between BSc optometry and OD in the USA. So do we apply for OD directly after BSc optometry? And there is something called pre-optometry, I believe, in USA. So could you
Not to
just
my
briefly
knowledge.
elaborate about the differences between all of them?
I have not come across something called a BSc optometry. I don't think such a thing exists. So, unlike India, the acceptance to optometry schools is after a baccalaureate program in the US. So, it's like a postgraduate degree is the entry into optometry school. So, they require you to have a 4-year bachelor's degree before you can apply to optometry school, preceded by taking what's called an OAT, optometry admission test, which is much like a GRE. So that would be the step to pursue. So the typical approach I've seen, those that have followed me here in the US subsequently, is to get into a research program that involves a master's / PhD. And while they are pursuing that, they are able to concurrently apply for some clinical courses and perhaps get an OD. But they still pursue their research interest because that seems to be their primary interest of practice. So I don't think there is such a thing as a BSc optometry or a pre-optometry in the US.
So the students studying in India and Nepal studying BSc optometry, this degree would be considered as a BSc over there.
Correct. It would be considered the equivalent of an undergraduate degree, yes.
Thank you, Dr. Keshav. I would like to go to Dr. Pawan here. You are working in the local hospital in Nepal as a research officer. So what kind of researches do you carry, and what are the limits or what are the scopes that an optometrist can go in case of research?
It has not been long since I joined the local eye hospital. It had only been about, I think, 1.5 months, 2 months, and then after that, lockdown started because of COVID-19. But then in those 2 months, when I started working in the hospital, I saw that it was a kind of a tedious process to get the ethical clearance done for any researches that we wanted to do, because all the proper research proposals from the hospital had to go to the national board called Nepal Health Research Council, and then it takes a long time there because every institute in Nepal submitted their research proposals to this institute. So what I wanted to do is establish our own institutional review committee, that is IRC, in the eye hospital. So I was working on the document for sorry so I was working on the document to prepare the standard operating procedures, and as soon as that was done, the lockdown started, and then there has been halt. So when I look at the hospital and then the research opportunities here, we lack in country like ours, we lack a lot in technology. And most of the researches that we are planning to do in hospital are small epidemiological like studies, trying to find out what is the prevalence and then incidence of diabetic retinopathy in the community, and then what is the prevalence of childhood blindness and then amblyopia, and what are the comorbidities in children with hearing deficiencies and then low vision, how about it, and then trying to find out all these kind of epidemiological data so that the hospital could actually start working on the strategies to work on these issues in the community. And about optometry researches, yeah, we are planning to do some school screening so that we can find out what are the issues with the, children in the school, and if they have any visual problems like amblyopia, and then how is the rate of strabismus there, what is the rate of binocular vision abnormalities there in those school children, and trying to find out strategies such that so that we can actually start working on it. So these are the ways we are looking at.
Thank you, Dr. Pawan. Next question, I'm taking a question from audience for Mr. Rekhi here. So for someone who wants to pursue contact lens as a main area of interest, how should they proceed towards it after completing the Bachelor's of Optometry?
Is the question that they want to establish a contact lens only practice, or I've not read the question.
I don't think that the decision has been made yet. So we have a lot of our audience are students still. So if they want to pursue contact lens as their main area of interest or work, so what would you suggest them?
So my suggestion would be, I think there's only been one person that I know of who had, actually two people. One person much before us, the generations before us, there was a gentleman in Chennai who used to run a contact lens only practice. But I think a couple of batches junior to us, there's a gentleman who actually set up a clinic which only did contact lenses. And he was very successful at it. He is very successful at it, Dr. Yashwant Shauji.
Yes.
But I think in today's scenario, doing just contact lenses may be a little bit difficult. I would still say that you still need to practice general optometry, and then of course with an emphasis on contact lenses, because when you start off, I don't know how many contact lenses patients you're going to get. Yashwant had the advantage that he came from a family of opticians. So he already had a patient load that was there, and then he could single out and probably do just contact lenses. But if you're a person like me who has no family background on these things, and it was a complete jump in the dark in 91 when we started the clinic, you have to start off by waiting for your first patient to come and do the best that you can with them. If I may add one more thing here, most of us come from institutes. And what I realized way back in 91 is that we don't have the skills required to run private practices. In the kind of institute that we grew up in, which is Shankar Netrale, we used to see 40 patients in our clinical work before lunch. Then we used to go for our posting. People used to wait to see us. And I would say out of those 40 patients, at least about 20 of them were serious cases. And when you start your own private practice, you start from zero. And your first patient is nothing like the kind of patients that you're used to seeing. So the skill sets that you require are completely different. So like one of the panelists had said, I think Shyam had mentioned that learn with somebody or learn to acquire those skills. We all learned the hard way. We jumped into the deep end of the pool and just learned how to swim. But these are skills that are required. And when you want to do only contact lenses, I would say there is a wealth of information around. There are fellowships in contact lenses which are available. There are specialty contact lenses. Irregular cornea is becoming a huge area today. The more the people do LASIK, the more irregular corneas that are going to come out also. And there are courses that you can do, but eventually it is how you practice. You have to start off practice at some point. So get the necessary skills, get the necessary equipment, start off your practice.
Thank you, Mr. Rekhi. So the next question we have is optometry an allied health profession or an independent medical field? I'd like to start with, okay, Dr. Shyam.
No, it's an independent field. In North America, we are not allied healthcare professionals. I'm going to allude to what Keshav was talking about. Actually, as an optometrist in Canada, I get paid by the government every time. So we have what we call as universal healthcare. So we are all citizens have a health card, and with that health card, whether the Prime Minister of Canada or whether it is me, we all go to the same hospital, same treatment. It's a standard treatment. So I actually get paid more than what a primary care physician makes. So I get more because I spend more time with the patient. And as optometrists, we are in the specialty area. We get paid more than what a family doctor gets paid for a patient. So we are independent healthcare professionals. That is here. I do not know how it is now in India or in Sri Lanka or Nepal, but here we are independent professionals.
Dr. Keshav, what is your take on this?
We don't have the government paying us here. It's the private insurance company that decides what needs to be paid. That's a completely different model that is set up here. Of course, insurance is tied to employment, which is another strange thing that happens in North America. So if you have employment, you get insurance through those, and each participant decides to sign on to that insurance plan or not is their choice. And when they're present in our office, there are sites that you log into, and you have to print out each independent patient's vision benefit plan, and the whole system is designed to obfuscate and confuse. That's how the insurance companies make money. So it is not easy or transparent. It is an independent profession, of course, driven largely by the challenges that the insurance industry poses on each one of us. But then there are a few people who do not opt to take on the benefits of the insurance company and choose to pay as a cash-only patient. So we offer a second tier, which is considered to be a discounted plan for those that do not have the benefits of a vision plan, and then they pay the provider independently. So it's now becoming largely a game of how many number of patients you can fit into a given 8-hour workday.
Thank you,
Dr.
Keshav.
Complications that you do. So the model has moved away from an optical model into a more medical model, which seems to be more lucrative, because the optical model involves you having the patient convinced to purchase something while everything is moving on to the internet. So people think they can simply get in front of a camera, then throw a frame on the face. It's $20. It's made in China or someplace outside of the shores, and it gets shipped to you. So including eyewear, the lens and the frame will cost you, $9.99, and they'll run a promotion first pair free. You can't compete in that environment. So it is challenging. We try to make a huge focus on our community involvement. Since I've been in practice for a long time, we associate ourselves with the local YMCA and the schools and the Parent-Teacher Association. We try to educate the public about the need for having a physician in your community that supports your community back. So it is an ongoing process as an independent practitioner.
Mr. Ramesh, what is your take on this? Is optometry an allied health profession or an independent medical field? So we might want to unmute the mic.
Yeah. So in India, while an optometrist can have their own independent practice, but I would still put it as an allied healthcare profession, because you are actually not able to give a complete end-to-end solution, right? So you can do an eye examination, you can dispense contact lenses, you can dispense a pair of spectacles, and the moment the patient or the customer requires a medical or a surgical intervention, then you need to refer them to an ophthalmologist. So the eye as such has got 3 different verticals. One is the ophthalmology, the optometry, and the opticians. So hence these 3 profession needs to coexist, and hence I would say optometry somewhere falls in the allied healthcare profession in India.
Thank you, Mr. Ramesh. Ms. Yukti, you also run a podcast channel called NerdyOptometrist. Am I right? So, will you tell our audience a little bit about that?
So let me actually share why I started that podcast was based on my initial journey and struggle to settle in a different country, trying to figure out the options and what can I do if I don't opt in for optometry. So I think that journey inspired me to share it and connect with people from different parts of the world. Especially, I started with Indians because that's what where I had my connections with, where I wanted people to understand and learn from the real experiences. So whether it is someone from Italy, or New Zealand, Canada, Australia. So that's what my idea was to help, whether it's a fresh graduate, whether it is a current practicing optometrist who wants to practice in a different country and restart the career. There was two ideas behind it. One is to give you connection where you can reach out to, say, Dr. Sham, Dr. Keshav, or even Dr. Kumari, to at least reach out and have that one person who's going to share their journey. And that's where I started this whole podcast called Nerdy Optometrist, to help people connect and learn and evaluate, is that an option they're looking for, and also realize that whatever you learned in India, or because that's where majority of my guests were from, they do feel that, oh, everything is greener outside and the world is perfect. So I think this gives them a real insight about the monetary returns, the immigration issue, the pre-tests or the entrance exam you have to go through. So that was my idea of starting the podcast Nerdy Optometrist. And I think now we are including much more than just across the country. We are going more into people's journey who have been like women in optometry. What I've started, I've also started another segment on public health. As Dr. Pawan had mentioned, I feel everyone ran away from this entire public health perspective, thinking, oh, it's a lot of epidemiology. I hate that subject. It's too much of research. But I did have a wonderful guest, Dr. Kovan Naidu, who did share the perks of it. And we also had another optometrist, Optom Shweta Patel, who shared, if you have the passion, it can be as rewarding as any corporate job would be, because it has the money. It's up to you how to utilize it and implement it. So those are the different aspects which I'm trying to discuss and talk through my podcast, Nerdy Optometrist.
Thank you, Ms. Yukti. So we have arrived towards the end of the panel discussion. And from today's discussion, I guess it is safe to conclude that optometry today is a field that covers a wide terrain. And with optometrists pushing boundaries each day, opportunities also increase by each passing day. So today I would like to extend a heartfelt thanks to all of our panelists for wonderful discussion and great insights. And I hope our audience listening to us today also have enjoyed the discussion. So before wrapping up, I would like to ask our panelists to share with us a few words, just a few words that they would like to share with us today, starting with Dr. Shyam.
Yes, I think optometry is on a very firm footing now, even in India, Sri Lanka. I've been to Sri Lanka many times. Nepal, I think we are much better than what we were, but we could do more. We could do more. And there is a tremendous responsibility on optometrists providing primary eye care, especially with things like diabetes. The leading cause of blindness in people over 50 is diabetes, and India is the world's #1 diabetic country today. So there's a lot of responsibility. There's a lot of onus on us to provide quality eye care, and this profession is in for big success. And I wish all the attendees and my co-panelists good luck and stay safe in this time. Thank you.
Thank you, Dr. Shyam. I'd like to ask Dr. Keshav to share a few of his words.
I certainly echo Dr. Singh's words. We as optometrists should stop thinking of ourselves as being just an optometrist. I think that was a mindset that at least that I came out of school way back then. But we have evolved on to show the world that we are a much bigger force to contend with, and we can contribute effectively to many aspects of our healthcare, public health research, and advancement of technology. the simple joy of being able to help somebody see is immeasurable, as we all know. And we've seen this, whether it is in our own private practices, be it North America or in Sri Lanka or in Nepal, or even in countries we've traveled to providing free eye services, Caribbean and so on. So, the joy that arises from the little things we do is not measured in dollars or rupees and so on, but we have to place a much bigger value on the strengths that we carry on our back. That's a knowledge, skill, and communication ability. So let's form a strong team. I'm looking to helping if there is a need and opportunity to make optometry in India stronger and be an advocate and a voice for progress. Wishing all attendees also good luck moving forward. Thank you.
Thank you, Dr. Keshav. Mr. Ramesh, I would like to request you to share a few words with us.
Yes, I think optometry is in a golden era compared to what it was 20, 30 years back. Today, I think the optometrists really have opportunities aplenty. So I don't see any reason why there should be a dilemma in an optometrist who is passing out after his bachelor's or master's. They should just sort of follow their passion and take up the profession which they are which they've opted for, and give it their best. And I'm sure they will sort of find their own area of interest as they move forward. And I'm wishing all the audience all the very best, and wish them a great career ahead. Thank you.
Thank you, Mr. Ramesh. Mrs. Fonseca, would you like to share a few words with us?
Yeah. Actually, I'm proud to be an optometrist because we can do so many things. We can change people's life, and we are improving the people's quality of life. So they come with some problem, and we give them the side back, and we send them back. And optometry is something which it's not only one thing. It's not only contact lenses or cornea, but if you know everything, so you can do a good job. And I mean, it's improving so much day by day. If you take only OCT, so many OCT things are improving. Low vision is improving. So every section is improving. So there is so much to do. And I think optometry is in golden era.
Thank you, Mrs. Fonseca. Similarly, I'd like to ask Mr. Rekhi to share a few words with us.
Couple of things I'd like to add here. I think everybody's mentioned the golden era of optometry, etc. Keshav mentioned something, that we should not limit ourselves to just the eye. And I think it's been my personal experience that over the years, our patients have become like families to us. And we have actually become more like primary physicians for them. So if they have a kidney issue, many times they get phone calls asking about that. And quite often, if your clinical skills are good and your observational skills are good, just the change in gait of a person sometimes helps you advise the patient to visit maybe a neurologist or whatever. And there have been cases where, the neurologist has called me back and said, if you had sent this patient 2 days later or 1 day later, he may not be around today. There are times you just notice patches on a patient's skin, and you just say, 3 months back, you didn't have this patch. Why is this there? And they give you some kind of a history. And if you can put it together and give him the appropriate referral, it might just end up saving his life. So I think don't look at optometry just as just the eyes or just contact lenses. Eventually, you're dealing with patients. It's a human being, and your personal contact with them and your own clinical acumen and your own skills, please allow them to grow so that you can help your patients. I would definitely advise every single attendee here, good future ahead of you. And yes, there are things that are happening in the market which are disruptive. So please do not limit yourself to just refraction, because that is not going to be there, because that's going to happen online. So you do need to keep your touch with patients, become a practitioner, become a clinician. And everybody, thank you so much for this opportunity. I enjoyed myself today meeting up with a lot of these people, and stay safe.
Thank you, Mr. Rekhi. Dr. Pawan, would you like to share a few words with our audiences?
Yeah, adding on to what other panelists have already said, it is the holistic approach that is actually very important to be an optometrist and then to be successful as an optometrist. The holistic approach, looking at the patient and while examining the patient or, talking to the patient, not just looking at their eyes, but, looking them as a whole person and trying to find out the root cause of the problems they have come to you for. That is actually very important. And during this time, some of the panelists already mentioned about the golden era in optometry. But then when you look at and then when you talk to the recent graduates of either bachelor's or master's in optometry, they would tell you about the competition that is there in the world today. Although the opportunities have increased, the competition has also increased, and it is being the best, and giving the best you can. That is the way to survive. And there are many career opportunities, many avenues opened. So be good at whatever you do, and then you will be successful.
Thank you, Dr. Pawan. Ms. Yukti, I'd like to request you to share a few words with our audiences.
First of all, thank you so much for this opportunity. It has been a learning experience for me, I'm sure, as well as for all the audiences. Just a couple of takeaways. One is, do not fear of failure. I think we all have experimented, tried something, did not like it, and then moved on to something else. So I feel that is one of the best thing of optometry, as you can, juggle between different roles. So do explore, do not hesitate. It's okay if you tried something for 6 months or a year and decided this is something I do not want to do for rest of my year. That's definitely possible. And whatever you do, I think, as everyone has mentioned, do it with a complete passion. I think that would be the way to enjoy it.
Thank you, Ms. Yukti. Again, thank you to all of our panelists for your kind words and the great insights that you have provided us and our audience today. Thank you again for joining me today for the ForOptom Optometry Updates Expert Live Panel Discussion. Dr. Shyam, Dr. Keshav, Mrs. Kumari, Ms. Yukti, Dr. Pawan, Mr. Ramesh, and Mr. Rekhi. Thank you so much from the bottom of my heart for being here and sharing all of your insights and your experiences with us. And I would also like to thank our audience for being here with us and for the love that you have showered to us time and again, and the support that you have shown us and for Optom. We will be back in future with more programs, sessions, panel discussions, and so on. On that note, I would like to end this session here today. Be a part of ForOptom team. You can also like, subscribe, and follow us on social media. For more information, please follow www.foroptom.com. And if you have any queries, feel free to contact us. You can also email us, and the informations will be on the website. So on this note, I would like to end this session. Stay tuned for more programs by ForOptom. Stay safe, stay healthy, and have a great day. Thank you.
Thank you. Thank you so much.
Bye. Cheers.
Bye.
Just a few moments. I think we might
Good to
be
see you
off
all.
air now.